The broadcast is now starting. All attendees are in listen-only mode.
All right, Dr. Berry, it's yours.
Okay, today I'm going to speak about sports participation in children with epilepsy. Epilepsy is a common disease. It's found in about 2% of the population. It affects both children and adults. Epilepsy is defined as having recurrent unprovoked seizures. Unprovoked seizure meaning there's no electrolyte abnormality or acute trauma to explain the seizures. There are about 3 to 6 million Americans living with epilepsy. Epilepsy is a chronic disease. The severity and prognosis is variable, usually based on underlying etiology or seizure type. About 60 to 80% of patients have an unknown etiology for their seizures or epilepsy, but the good news is that up to 80% of patients can be well controlled on 2 or fewer anti-seizure medications. Seizures are usually classified in the following types: generalized, focal or partial seizures, and focal with secondary generalization. These are a few of the generalized seizure types. The one that most people are familiar with are generalized tonic-clonic or grand mal seizures. During these seizures, the patient loses consciousness, there's whole body shaking. Often it's associated with tongue biting or urinary incontinence. These seizures are of variable duration. Usually they're lasting 2 minutes or less. Absence seizures are a second type of generalized seizure, also known as petit mal seizures. These seizures are very brief, lasting just a few seconds, and they're characterized by staring and unawareness. Myoclonic seizures are also generalized seizures. These are characterized by a brief jerk of the arm or leg. If somebody is holding an item in their hand and they have a myoclonic seizure, they may drop it. These seizures usually last less than a second. Atonic seizures are characterized by a sudden abrupt loss of tone. These seizures are associated with a lot of injuries because the loss of tone causes the patient to fall to the ground. These are the types of patients that usually require helmets if they're having frequent atonic seizures. Focal seizures are divided into 2 types. In simple, focal, or partial seizures, consciousness is preserved. There's usually twitching of one side of the face or body. Patients may complain of numbness. Some have visual phenomenon, but what links them all together, simple partial seizures, is that consciousness is preserved. The patient is aware that they're having the seizure. In complex partial seizures or complex focal seizures, there's an impairment of consciousness. They don't lose consciousness, but they're impaired. If they're speaking, the speech is incoherent and it's not making sense. They can have twitching of one side of the body. Often there's head or eye deviation depending on which part of the brain the seizure is originating. There are various etiologies for seizure disorder or epilepsy, and sometimes it's a congenital malformation of the brain, such as lissencephaly, which is the smoothness of the brain, or absence of the corpus callosum. There are patients who sustain hypoxic ischemic encephalopathy, which means that they're deprived of oxygen and blood flow to the brain during delivery, and they often develop developmental delays, cerebral palsy, and seizure disorder. CNS infections such as meningitis or encephalitis can also predispose a patient to epilepsy because it leaves scarring on the brain. Toxic metabolic, there are certain metabolic diseases like enzyme deficiencies that also put a patient at risk for seizures. CNS neoplasms like glioblastoma, even low-grade gliomas can lead to epilepsy or recurrent seizures. Traumatic if a patient sustains a severe head trauma or traumatic brain injury, they can have seizures in the immediate time after the event or incident, or seizure can develop months or even years down the line. When a patient presents with recurrent seizures, these are some of the tests we order. The most important is the electroencephalogram, or EEG. This records the brain activity. It can record seizures themselves. When you capture an actual seizure, it confirms the diagnosis. It also indicates the potential for seizures or spikes that indicate that a patient is at risk for seizures and what type of seizures they're at risk for. A video EEG is just a prolonged monitoring. Often we do it overnight in the hospital. Now there's a capability to do an ambulatory video EEG where the equipment goes home with the patient and monitors for several days. An MRI of the brain is often performed in patients who are diagnosed with epilepsy, looking for any structural abnormality, stroke, tumor that may give us a cause for the underlying seizure disorder. These are some common EEG abnormalities. Slowing indicates a dysfunction of the brain. It's often seen in patients who have a baseline developmental delay. And also you can see spikes. Spikes are abnormal discharges indicating that a patient is at risk for seizures. The spikes can indicate whether they're at risk for generalized seizures or focal seizures. And then, of course, when we capture seizures themselves, we can do that on the EEG, and that's what confirms the diagnosis and the seizure type. These are just some pictures of EEGs. This is a normal EEG. This is a picture of an EEG of a patient with slowing or brain dysfunction. This is showing focal spikes. The blue lines are the left side of the brain. The black lines are the right side of the brain. This patient has spikes on the left side of the brain. Going back, just indicating a focal seizure disorder. This is a picture of an EEG with generalized spikes. As you can see, both the left and the right side of the brain are involved in this abnormal discharge. And this is a picture of a seizure where there's prolonged synchronous rhythmic abnormal electrical activity. And in this EEG, it's involving both the right and left side of the brain. The treatment for epilepsy or seizure disorder is usually medication. We have a variety of medications. I've listed just a few of them here. The choice of medication is usually based on the type of seizures a patient has, such as generalized versus focal, EEG findings, the side effects, age, and sex of a patient. So there are certain medications that we reserve for male patients because of the side effects or teratogenic effects for adult female patients. A second medication is usually added if seizures are not well controlled on the first medication. These are some alternative therapies. The ketogenic diet, which is a high-fat and protein diet, is used for refractory epilepsy. It's been shown to reduce seizure frequency. Also, vagal nerve stimulator and surgical resection are used to treat patients who have failed medication and ketogenic diets. And those particularly get surgical resection that have a discrete focus on both EEG and imaging, such as MRI. So the history of sports and epilepsy. A stigma has been associated with epilepsy has prevented involvement in sports and recreational activities for years. More recently, a more permissive approach has been taken towards children with epilepsy and their participation in sports. New evidence actually suggests benefits from exercise without increased risk of injury or increased seizures. Due to stigma with epilepsy, those with epilepsy have poorer self-esteem. Restricting a child from participating in sports led to isolation from peers and lower self-esteem. The American Academy of Pediatric stance is that risk of sports should be weighed against the psychological trauma resulting from unnecessary restriction. In 1968, based on American Academy of Medicine physicians recommended restricting the activity of those with epilepsy. In 1973, articles presenting arguments both for and against allowing participation in contact sports were written. In 1983, AMA and AAP recommended participation in most sports, including contact sports, provided patients were well controlled and there was proper supervision. Despite progress, most studies show children with epilepsy are 50% less active than those without. Unnecessary restrictions are set for fear of injury or induction of seizure activity. Multiple studies have found that physical exercise actually decreases seizure frequency. The potential for injury exists, but it's not significant. One study showed no difference in the number of accidents that children with epilepsy had during sporting events compared to those without epilepsy. However, 27% of patients with epilepsy who had a seizure during a sporting event sustained injuries related to the seizure. Those with epilepsy are 4 times more likely to have submersion accidents such as drowning or near drowning. Sports involving heights can increase risk to the participant and others. There are rare cases of exercise-induced seizures. One study found 247 out of 400 people with epilepsy could identify a precipitant. Only 2 out of the 400 identified physical exercise as a precipitant. Playing, whether organized sports or in recreational activities, is normal and beneficial part of life. All benefit socially and physically when play begins at an early age. Studies have shown that physical activity on average reduces seizure frequency and led to improved cardiovascular and psychological health. Sports restriction may impact child from a psychosocial standpoint. A sedentary lifestyle poses greater health risks than sports participation itself. Patients with a sedentary lifestyle, those restricted from sports, tend to have an increased BMI, decreased aerobic endurance, poorer self-esteem, and high levels of anxiety and depression. Prior to participation, these are some general precautions that should be taken, and it's following methods of conduct and play, utilizing suitable protective equipment such as helmet, if appropriate, and playing responsibly within the rules of a given sport. Special precautions for children with epilepsy include determination for risks for injury and physical impairments depending on the type of sport, which I'll get into later on, the type and timing of a seizure. Patients who have generalized seizures, such as generalized tonic-clonic seizures and atonic seizures, are at a much higher risk for getting injured during a sporting event than those with simple partial seizures, in which consciousness is completely preserved during the seizure. Also, it's important to confirm that there's adequate seizure control with medications. For patients with subtle seizures, such as absence, adequate control should be confirmed with EEG. For those who have more obvious seizures, then we speak to the parents and make sure that they're not reporting any active seizure activity. We also follow medication levels to ensure compliance. And for patients playing sports, there's increased vigilance about proper diet and rest. So what is adequate seizure control? There's no consensus. Adequate control is largely individualized. Of course, complete seizure freedom is every clinician's goal, but in some patients it's impractical. Some require multiple medications to control their seizures, which results in side effects such as lethargy and confusion. The side effects of the medications, like lethargy and confusion, can put them at risk for injury during sports. But luckily, most patients are able to be controlled on one medication. Those patients should definitely be encouraged to participate in sports. The International League Against Epilepsy recommends that if a child has been seizure-free for more than a year, that most restrictions can be lifted. So again, provided seizures are reasonably controlled, most sports are acceptable to play. Some may require some additional supervision. With patients who are participating in sports, it's important to monitor adequate seizure control, close monitoring of their medications, and their family and the coaches should be prepared. And the coaches should be aware that the child has epilepsy, and they should be aware of what to do in case the child were to have a seizure during a sporting event. So aerobic sports such as running track and field or stationary bike conditioning, these aerobic sports have no specific risk if fluid intake and electrolyte balance are maintained. They should have adequate preparation with diet. It can actually decrease seizure frequency, reduce future health problems, and improve body self-image and self-esteem. Children with epilepsy should not be precluded from contact sports such as football, hockey, basketball, and martial arts. Theoretically, trauma from contact sports resulting in recurrent minor head injuries could cause or worsen epilepsy. There are very few case reports that support these notions. Many studies have shown no increased injury risk for children with epilepsy who play contact sports. Boxing is an exception and is prohibited in those with epilepsy, according to American Academy of Neurology, American Medical Association, and American Academy of Pediatrics. Water sports. So swimming and water sports are an excellent way to improve cardiovascular health and maintain muscle strength and tone. Direct visual supervision should always be present, and the supervising person should have adequate training in rescue and resuscitation. So it's not enough to just have somebody, at the side of the pool. It should be somebody who can go into the water and rescue the patient if they were to have a seizure in the water. Patients with epilepsy are discouraged from swimming in open water. Swimming should be avoided in those who are having frequent seizures. For obvious reasons, patients who are poorly controlled and are having frequent seizures are at high risk for submersion injuries or drowning. The boating is allowed with a flotation device. Scuba diving is prohibited. Gymnastics involves an increased risk due to certain skills that are performed at greater heights. It's okay for children who are well controlled, and if they're observed by coaches who are aware that they have epilepsy and are aware of what to do in case they were to have a seizure during the event. Some references do not recommend gymnastics, especially balance beam and uneven bars. Having seizures during these events can result in fall and potential cervical spine injury. Other references allow gymnastics with reasonable precautions and direct supervision. Horseback riding and harness rock climbing should only be encouraged if seizures are well controlled and these sports are being performed with a person who can provide first aid and contact emergency personnel if the child were to have a seizure during participation in these sports. Hand gliding, parachuting, free climbing, those are not recommended. Motor sports, some say patient has to be seizure-free for a minimum of 2 years prior to participation. Motor sports, we have a great possibility for catastrophic injury. An accident at the high speeds attained in motor sports is a danger to the driver, other drivers, and the spectators. Most feel that motor sports should be avoided altogether in patients with a diagnosis of epilepsy. This is just a chart with some of the sports, or with more specifics about the sports, which ones are permitted, some possible sports with reasonable precautions, and those that are prohibited, such as boxing, scuba diving, and rock climbing. This is just from another reference looking at specific sports and whether they're allowed. Again, there are very few. If you look at the list of sports, there are only very few that are absolutely prohibited in patients who have a diagnosis of epilepsy. In summary, aerobic sports such as running track and cross-country skiing have no special precautions. Contact and collision sports such as basketball and football should be undertaken with usual precautions and direct supervision. Swimming should be under direct supervision by an experienced swimmer. A child should always have a buddy system, should never be in the water alone. Sports such as hand gliding, scuba diving, and mountain climbing are not recommended due to the risk of severe injury or death if a seizure occurs. Boxing is prohibited since head trauma can precipitate seizures. So in conclusion, participation in sports and physical activity is an important way to maintain health, physical and psychological health. Children with epilepsy should not be excluded from participation in sports. More harm may be caused by discouraging physical activity. Sports involving heights and speeds, motor sports, are not recommended, but the majority of sports are safe and will potentially reduce seizure frequency and improve quality of life. These are just some of the references I used. If you have any questions, they can be emailed to the following email address.